at the age of 27, where I was running a billion-dollar plus portfolio. So I did that, for several years and grew it from 10 million to 250 million by the time I was 35. She finally had a successful outcome, after several years. Got her final surgery at Duke and has now been in remission for 5 years. On a positive note, we ended up having our first child after the whole experience, which they said was statistically impossible. So we have a happy, healthy 4-year-old baby daughter.
All humans have this potential to become the hero of their story. So I acknowledge you for going through that moment, which Carl Jung calls the dark night of the soul.
Medicare is now going to start using AI to process and deny claims. Our healthcare system is great, but it does like 5% of the work. Like 95% of the work falls on the family and the family caregivers.
A lot of these journeys come from wounds, right? From deep moments of trauma.
Two vascular surgeons walk into a bar and come out with a podcast. We are talking everything vascular and not. Welcome to the Life of Flow podcast.
The following podcast is not relating to my teachings and work at Del Cedar Medical Center and is for entertainment purposes only.
Hello, everyone. Welcome to the Life of Flow podcast. And today we have Neal Shah. Neal went from being a successful hedge fund manager managing billions of dollars to then going through the healthcare system and going through what our patients go through and getting the scars and coming out on the other side and deciding he was going to do something about it. So I hope you guys stay until the end to hear his story, hear the change that he's creating, and follow him, support him, look him up, reach out, because this is an incredible human and we're lucky to have him here on the Life of Flow podcast. So vamos. Neal,
Welcome to the Life of Flow, brother.
Welcome to the Life of Flow.
Thanks for carving a Saturday morning
out of your busy life, because you are doing a ton of stuff.
I just feel like people that want to sit with us on a Saturday are a special breed. Because if I get asked to do something on Saturdays, it's really, really hard for me to accept it. Because I just find my weekends to be, I don't know. But I appreciate you, Neal, being here. It means a lot. And I think our conversation is going to be very useful for a lot of people that follow us. It's going to feel very personal for a lot of people that follow us. I'll tell you, it will for me. But we'll get into that. And so I think that maybe to set the stage, this is the first, hopefully, of many times that you'll be with us.
Thanks.
Tell us a little bit about your journey, where you started, where you grew up, maybe how you ended up deciding to go into this particular part of this profession.
Sure.
Where'd you go? Where'd you do your grads and stuff? And then how that story has gotten you to the point where this has become a passion project for you.
Yeah, sure. Happy to. So I grew up in a healthcare family. My parents are immigrants and, grew up in North Carolina. And, I kind of had thought about going into healthcare directly myself. But, after school, I went to school at University of Pennsylvania. Kind of like the rite of passage was everybody there went into finance for a couple of years. So I was like, okay, let me try it out, and went into investment banking and, was kind of good at it and, was rapidly getting promoted. So I kind of stuck with it throughout my 20s. I very quickly got an opportunity to join a hedge fund kind of in the early days of hedge funds in the, kind of early 2000s. Joined one and, very rapidly became a partner and director of research at the age of 27, where I was running a billion-dollar plus portfolio. And, had a great run, actually. Interestingly enough, I was the only person at the fund doing restructurings and turnarounds during the financial crisis of 2008, 2009. So ended up having a lot of capital allocated to me, generated really good returns. And by the time I was 31, one of the investors backed me to start my own fund. So I did that, for several years and grew it from 10 million to 250 million by the time I was 35. I was still living in New York at the time. And, at that point, a series of family caregiving experiences happened to me rapidly within a couple of years that really shifted the trajectory of my life and career and, brought me to what I'm doing today. First I went through my grandfather's dementia care. My whole family was taking care of him, but really I'm the person in the family that everybody relies on for like research and care coordination and figuring things out. And that was my first foray into kind of like how difficult it is when you have a loved one with a serious illness like that. Our healthcare system is great, but it does like 5% of the work. Like 95% of the work falls on the family and the family caregivers. And, I kind of became obsessed with how broken the home care industry is and how difficult it is to get help. So that kind of, I'll get back to that later, but that really was an inspirational point in managing his care for several years. Why was it so difficult? My mom ended up just leaving her career and just doing it full time for several years. And after he passed, I was still running my fund, and I started shifting my fund into investments, in the sector, and just kind of thinking where there are opportunities. Unfortunately,
Hey,
at the
Neil,
peak of
let
my
me let
career.
me interrupt you. Let me interrupt you there quick because I just would love to know
Sure.
that first pretty accelerated growth of your fund.
Yeah.
Where were you focusing the majority of your investments during that period?
Yeah, yeah, great question. It was very opportunistic because it was turnarounds. So wherever there were troubled companies. So this was kind of like the 2010s. So a lot of the investment opportunities, there were some around healthcare. There were a lot around telecommunications. There were a lot around kind of the real estate sector. Interestingly, there were some of the best investments were around the chemicals industry. Which in hindsight, because of the cost advantage of American natural gas, just became like extremely competitive on a world stage, and people at the time did not see that. So I'd say they were kind of like all over the place, but the common theme was out of favor things where I thought there were bright prospects, and I had a contrarian view. And I would say that's kind of maybe been that defining of my investment career in the past was contrarian views. That where people weren't looking, or where people had just assumed there was no opportunity and left something discarded. I kind of found um, you know, are there opportunities?
And can you talk about some of the pain points that you found in taking care of your grandfather? Because
Sure.
I can imagine, we're taking care of, like, mostly my mom is doing a lot of taking care of my grandma, which has had multiple,
Yeah.
like, femur fractures, and it does
Wow.
require in, and a lot of time from the family,
Yeah.
which is great.
Yeah.
Like our grandparents, our parents deserve that time. But it takes it just in the best situations where you have a stable economic situation,
Yeah.
it's difficult. I cannot imagine if you're working two jobs and you're struggling
Yes.
to make ends meet, what
Yeah.
that is. Yeah.
100%. I'm glad you brought that up. I mean, 63 million people in the country are doing this right now, which is like, first of all, shocking. It's like, it's relative to how little it's discussed in media. Almost one in five adult Americans are spending over 10 hours a week taking care of a loved one with serious illness or disability. Um, I think what I found, some of the biggest pain points, and, we had resources, and I still found probably the biggest pain point, which really inspired some of my future work, was the cost of home care is extremely expensive for relatively low quality. And by that I mean if you need a break, like let's say if you're my mom and you're like, okay, I want to have 6 hours a day to myself, a few days a week, and you go out and try to hire some help. It's a pretty antiquated 1980s, 1990s way type of doing business. You kind of go find local companies who are running these franchise banners with national franchisors. You typically pay them, I think in most markets, it's around $35 to $45 an hour. Those companies turn around and pay less than half of that to the care worker. The rest of the money is like overhead, markup, advertising, royalties to, the parent company, et cetera. So you end up basically getting a care experience that you're paying top dollar, sometimes, $1,000+ a week, depending on how many hours you need. If you just do the math on, 40 hours times $40, it adds up. You're paying top dollar. You're getting fairly low quality of care because these companies are like paying the care workers next to nothing. So despite like good intentions, a lot of people just leave and go to, take a job at McDonald's or take a job at Walmart, it pays better. Um, so you have that kind of issue. And then that really feeds back on the family, where the family member feels guilty. And they're like, well, this is my loved one. This is my mom, dad, husband, wife, grandparent. And this is what I'm going to leave them with, somebody who doesn't really care. Um, a lot of times the care workers are, I found in our journey, multiple hours late, at least once or twice a week, sometimes often no shows. So something like 15% of all care appointments across the industry fall in that category, either more than 4 hours late or no show. So I think that generally the problem is the lower quality creates a pain point for families, where many families will end up topping out and doing it themselves, which I think then has second and third order, impact in terms of on the family caregivers, personal, physical health, mental health, and often financial health. People with quick careers to do the care because they can't manage both. So I thought that was one of the. I mean, of course, there's a laundry list of other challenges when it comes to that. But I think the difficulty of getting help and the amount of burden it puts on, usually it's one lead family member doing it, is, I think, insane. And I'm surprised it's like not discussed more.
So going back to your train of thought, you then, you had put all this money in certain opportunities that you felt other people
Yeah.
didn't see, worked really well. Then you started dealing with all this personal issues, and you were starting to pivot. And I interrupted
No
you, but I
worries.
want to go back to it. You're starting to pivot that you then said, you know what, maybe there's a chunk of some of these investments that I should put on some of these things, shaped by some of my personal journeys and hiccups in
Yes.
healthcare. Is that kind of where you were
Yeah,
going?
yeah, I
Okay,
think that's
so
a great,
so
I kind of
what
like,
did you
I
start
almost had
doing?
like a big like insight at that point that, when I was running my fund, that I was like, oh my God, like the population is aging rapidly. The number of people living with serious illness, chronic disease is growing very fast. And this entire market on how we take care of them, at home and how the family members have to do with it is completely broken. So I was like, okay, there's got to be really interesting opportunities here. So I went like deep into a rabbit hole, and thanks for actually letting me share that story, because sometimes I actually gloss over that part because unfortunately the later part was worse. At that point in my life, my wife became severely ill and went through a major battle with cancer, and I became the primary caregiver. So that was incredibly difficult. That I firsthand saw. It's like when I was like researching and coordinating for my grandfather, like, yeah, I wasn't physically doing majority of the care, my mom was. But I think in my wife's case, it was eye-opening even more that I was physically doing a lot of the care. When I tried to get care help, I actually found it very poor quality and, felt a responsibility. And I had a challenging career that I'd worked, probably throughout my 20s and until my mid 30s, I'd worked, 60 to 80 hours a week, like consistently to get to that place in my career. I'm like a very hardworking person. So I was like, oh, what am I going to do now? Where I'm running this thing, the employees are there because of me. The investors are there because of me. There's kind of no backup plan because it's relatively nascent organization. Um, so yeah, I had to take multiple sabbaticals for my work to manage my wife's care. And, there were multiple, um, you know, ICU hospitalizations. At one point was in a medical coma, with bilateral pneumonia, with sepsis, and I was just taking massive amounts of time off from my fund, which became just kind of difficult and untenable. So I ended up making a difficult decision to wind down my fund and become my wife's full-time caregiver. And through that whole journey, moved back home, just to be near family and, get even more help. And, pleased to say, knock on wood, she finally had a successful outcome, after several years. So, got her final surgery at Duke, and has now been in remission for 5 years, a little over 5 years, actually. And we actually, on a positive note, we ended up having our first child after the whole experience, which they said was statistically impossible. So we have a happy, healthy 4-year-old baby daughter. Uh, and yeah, and then after that, I was just like, all right, I'm gonna go nuts. Like, like it's like I'm gonna focus my life on this, because like, it's like I lost interest in finance. I mean, I'm not to say anything bad or whatever. It's like, kind of looking back on my life, it was like that work was not that meaningful. And I found like something, okay, there's something I find that has like significant meaning and purpose to me, and that there is a tremendous amount of suffering and pain that is going on in the world, that I've been in years of dementia support groups, cancer support groups, chat and bond with all these other caregivers going through this. Many of them are not fortunate enough to have that many resources. So I was like, okay, I'm just gonna, just do something here and figure it out and kind of, go shift my life path, at 40 to focus on this.
It's very interesting to hear this recurrency. I don't know if now we're what, 100 and something shows, and I start threading this recurrent story of your you talked about this term of your hero's journey,
Mm-hmm.
right? That every one of these big challenges are the moment for you to pull in that inner hero and go on that journey out, not knowing if you're going to come back, to the castle after fight your monsters. But a lot of these journeys come from wounds,
Yeah.
right? From deep moments of trauma, and in this case, this obviously very hard story that you shared with us, very candidly. But it's interesting how it's those moments that then lead the way to clarity.
And to becoming the hero of your story.
Yeah.
To becoming the hero of your story, which is, I think, something really important, that comes across. I think all humans have this potential to become the hero of their story. So I acknowledge you for going through that moment, which Carl Jung calls the dark night of the soul, which is sounds like what you went through with your grandfather, and then finally your wife. She was in a coma with sepsis. Then you guys came out, have a beautiful family, and you
And I'll
dedicated
I'll
yourself
be honest, I don't
to helping
think
others.
this is just a personal comment on it, but I don't think every other man in your position would have given up on a successful fund. I
Yeah,
mean, you were killing it, man, right?
yeah.
I mean, you were knocking it out of the ballpark. You were doing some pretty amazing things. People had trusted millions of dollars, and you were generating returns. And to say one day, all of that energy, all the
Hell with
power,
it. Yeah.
to hell with it. I'm going to wind it down, and this is what I'm going to do because this is what's important for my soul. I think that puts you in a very special point as a human being. It really does. But let me not deviate from where we're at, and let's go back to the journey because I'm by the way, I want popcorn right now because you're a very good storyteller. And I wanna see where this goes. So you make it after all this. You've got this beautiful kid. And so now you were like this aha moment of clarity. I'm going to put all this energy, all this experience I have into something else. So walk me through what was your
Yeah.
deal
Yeah,
there?
so there, actually, it was, kind of I'd say the start of it was simple, and then you realize when you're getting into it that it actually gets way more complicated than you thought. But, sometimes you have that naive optimism, like, if I knew how hard the first couple of years was gonna be, I might have had second thoughts, but, basically, the start of it was, okay, I had this idea that, I basically had the idea of problem and solution, so problem being that when you as a family caregiver, which I would say, I've kind of gone through, seen so many other people gone through, and when somebody in your family, a loved one, is going through a major, major either health crisis that lasts for a few years or just aging, which is going to end up, terminal, um, you need help. And it's very hard to get help, and it's very hard to get help that's good quality. So how do you kind of go about it? So my idea there was, you know, in all the types of care I'd gotten, healthcare students had been what I thought was a hack. That so many caregivers in support groups were telling each other. We had done it. We had several other caregivers that I've been friends with in support groups do it. And, they'd found, kind of their local school, go to the nursing school, go to the biology professor and ask, hey, do you got any good students that can help my mom and dad? With care. And I'd found, okay, this is a great kind of gray market, what I would find, but why don't I bring it to like a formal economy, the way that, Airbnb brought like travel stays, to like a formal economy, or, Uber brought, kind of like ride sharing. So that was kind of like the idea in a nutshell. It was like, this is a problem that many people are experiencing. I think I have a solution that could work. And why don't I try it out and, roll something out and see how it goes? In the first, like, when I started on that journey, and I had a bunch of other ideas of like other things I'll do down the line from all the experiences and challenges I've seen in caregiving. But this was kind of the main starting point idea, mainly because I thought it was like straightforward and could help people. So it was like, let me take all this burden off these families' back, that you got to go find these students, you got to go talk to professors, you got to go background check them, you got to vet them. Scheduling is a huge pain, right? Because a lot of these, students will not be able to do every single day, 5 days a week, 7 days a week when you need. So if you develop a technology system, a lot of this stuff can be streamlined, and then you'll be unlocking this amazing workforce across the country. And kind of final point being, from all of the students we had help from, and from all the students I talked to with other caregivers, the most importantly, the students love the experience. That they are so grateful, and it's a formative life experience for many of them. Before they go on to grad school, clinical careers, etc. So, I was like, hey, this could be like a mutually beneficial solution for society. Um,
Neal,
sure.
let me interrupt you quick. Why limit it to only medical students? Because I can foresee a medical assistant or even somebody that's just a very good caregiver have an actually 5-star profile, not necessarily be a medical student, and say, I want to provide care and I'm going to give you the $30 care level you deserve, not the
Yeah.
$10 level. And I want to be in this
Yes.
platform. So would that not be, would that not be a way of limiting your market size to potential, or is it just adding complexities to a lot more
Yeah.
unvariable things
No,
that you would
great,
be
great
able to
question.
control?
Great
What's your
question.
thought?
I think that that is a down the line plan, and I kind of thought, okay, in a lot of successful startups, you almost go super niche at the beginning because you're like, okay, it's easier to manage, you don't have a lot of resources, and you can be known for that thing. And then over time as you grow, you can kind of expand out. So here I thought, okay, I'm living in Raleigh, Durham, North Carolina, right where my family is. I'd relocated here. Near me are there 3 major universities within literally 20 minutes drive, UNC Chapel Hill, Duke University, and North Carolina State University. And there's 100,000 plus, students here. And I think approximately 20% of those, are trying to go into healthcare careers. So I was like, okay, if I start here, the possible market in terms of like how many students we could engage is so high that if we just really niche it to and we did kind of like a broad niche, but it was, nursing students, pre-medical students, people who want to go into physician
Okay.
assistancy, and then over time even expanded to physical therapy, occupational therapy. So we kind of said anyone pre-clinical
Brilliant.
career at these 3 universities we could engage. And
Brilliant.
then that was the start. Like actually MVP was even narrower. MVP was just UNC and Duke. And it was like, let's find 100 students, to go on it. But great point. I think long term could expand, beyond that. We started that and it just took off. It was like shocking of like the need, but then there were a lot of like growing pains on how do you keep managing it? How do you do it all through technology? The amount of manual labor that was going into it was nuts. But, to kind of like fast forward the story a little bit, you know, the tech system worked really well and it unlocked a lot of demand because we realized a lot of the middle-aged family caregivers were like busy with their careers and they're like, hey, if there's a convenient app where I can just kind of like book, schedule, pay, I know it's reliable. I know, I can see ratings, reviews, like all these things, by the way, in 2025 that we think we take for granted in online food delivery apps and ride sharing apps, these don't exist in the care industry, in the home care industry. So, I think it was like kind of like novel innovations when we started doing it. And yeah, within 3 years, it's gone from kind of like this idea, then this local thing to now we are around the country. We have over 45,000 students on the platform. So it's like one of the larger care workforces in America. It's a 6-person startup, run off our, computers. And I think that's like pretty cool. And yeah, we're in over 15 states. And I think that there's like a tremendous growth opportunity.
Whoa. 15,
15
15
states. Yeah.
states.
Yeah.
That's amazing.
Yeah. The last year
That's
and changes, it's
crazy.
been like viral growth. It spread to so many
That's
campuses.
crazy, Neal. So, Neal, tell
Sure.
me something because you and I are colleagues here in the
Sure.
software world. Uh, I have my own little MVP, and it's a thing called Flight Path, and it's a thing that I built because as I came out of
Okay.
corporate medicine and into my own practice, the only way that I can scale is by having high quality
Okay.
feedback from all of these remote places that I'm starting to open
Okay.
for care. And so I built this platform, but it's daunting for somebody, and I don't know how much your software
Sure.
background is, but it's daunting for somebody like me that knows zero about coding and software, how to
Yeah.
kick that off. And so for me, it was like endless hours on on these freelance platforms to try to find some coders that also were bilingual because I wanted to be English and,
Yeah.
and Spanish. And I finally recruited these kids from Mexico, and they've
Yeah.
done okay work. But every day that goes by, I'm nervous that I'm wasting time, not having the right engineers and the right coders behind it that can allow for true scalability to a platform like yours. And so what I was told essentially was you need a CTO. Like you just need to find a nerd that does this, that has a track record, that knows exactly where to outsource, and then have a fractional or potentially some sweat equity in that company. But anyway, would you tell me your own journey on that? And maybe you had a bunch of experience from your your hedge fund times, but tell me a little bit about the software development and
Okay, great.
such.
Yeah, sorry by the way, it cut out for a sec. But yes, yeah, happy to share. So couple of insights. One, I used to be a computer programmer in high school and early college, and then partway through college,
Of
the dot-com
course.
bubble burst. So I shifted also then, kind of what I thought I might go into at that time. But to be honest, like my skills are pretty rusty, right? So, modern frameworks I can kind of be okay with, but I'm not like the expert on it. The biggest kind of blessing was I found a co-founder very early on in my journey after like I having the idea and prototyping. And interestingly enough, my co-founder was right out of college. So 22-year-old guy, genius, like absolutely genius software developer. And I think that that has been a awesome combo of like, okay, I have like the idea, the entrepreneurship and business skills, ability to fundraise, ability to scale something, and he had like the technical background. So I would say one thing I think, just suggestion or tip, is get a very talented person who is good at that thing with skin in the game, if like true co-founding. Get
Put
them
them
on
on
the
the
cap table.
cap
There's a
table.
great book, by the way, I would recommend called Ask Your Developer by Jeff Lawson, the founder of Twilio. And I read that early on, and it really changed my thinking of like, in this, like, let's say the philosophy is we're trying to build a care company, but like, it's not a care company that is going to use software as needed. You want to be like, it's a software care company, in terms of like, you want that to be the foundational like ethos of the company. And I think in order to do that, you have to elevate the developers. And, of course, I'm like a very amateur developer, right? But I'm not like the main developer, and there are very talented people like my co-founder and others on our team that are like extremely good at it. And you have to elevate them with like, not just like a seat at the table as like a well-paid employee, but as like executives and co-founders. And I think that
Okay.
like is initially interesting because like, as you can imagine, and to your earlier point, when I left my fund, yeah, a lot of my friends were like, what are you doing or whatever, and it's kind of funny that I've had this like
Yeah.
journey where like people don't understand some of these decisions because like maybe they don't make them that way. And then after that, it was like, okay, then my life is better. And I was like, I'm going to do this. And by the way, I'm going to do this as a successful 40-year-old. Yeah, I'm going to, team up with this guy right out of college. It's being like, what? And I was like, well, without the guy, and I would say the guy's like very talented, and we both got,
You wouldn't
yeah,
have
no
been able to
chance,
build a
no
company
chance.
without him.
Yeah, no
Period.
chance. And
Yeah,
like
there
the
you go.
typical
Yeah, yeah.
40-year-old, like all my friends were like, oh, you just pay someone to do that. I was like, no, that's not the point. It's like you want them to like feel the problem and own it. And I would say kind of like I've taken, somebody without like any kind of background in caregiving or even any family experience in the journey. And he's become as obsessed with the problem as I have. And through that, we've found other problems to solve. So yeah, I think that's like at least one, my tip for whatever it's worth is find somebody who's very talented in that field and elevate them to co-founder, or some sort of kind of, on the cap table. And I think that makes a huge difference in the trajectory. Because I think,
I'll talk to you offline because maybe he can introduce me to
yeah,
a couple of
sure.
good guys. Some of his
Yeah,
classmates
yeah.
that are
I
still
mean,
Yeah, they're
that
still
are
looking to
that
found
are
a
yeah,
still
company.
some
not
of
on a
these
cap
people coming
table.
out of
Yeah.
school nowadays, I mean, it's like unbelievable because like the stuff has changed so fast, right? Like I think in the
Unbelievable.
last 5 years,
Yes.
the realm of software development has changed so much that even if you talk to somebody who's an amazing developer in 2015, because I think that, and not to get a tangent on this, because of the rise of AI assisted coding, the people with more experience have been more resistant to that. Whereas the people with less experience
Mm.
and ability to learn fast are just like, oh, I can do 5 times more things faster. And I think it's a philosophical difference. So I find that that makes a big difference in your output of your engineering team. And we have like, that's how we're able to run a relatively sophisticated platform with so few people.
Through that kind of like iterating through ideas, is that through where the AI, the
Yeah.
now management software came
Yeah.
came out of? Is that you guys just bouncing ideas off each other and it's like, oh, I can
It's
do
it's
this really
actually
easily.
seeing a problem. I mean, we've launched a bunch of things. Like for a surprisingly like small number of team. This is the AI for claim management is probably our most like notable, side hustle, so to speak. That's turned into a big thing now. And by the way, there's only one full-time person on that. and the rest of us are kind of like doing that on nights and weekends. But interestingly, yeah, it came out, a lot of the innovations we've launched ancillary are out of problems that people using our service are experiencing. So we saw a lot of these family caregivers were fighting denials for their loved one, and many of them, whether it's like hospital bills, whether it's rehabilitation after a stroke, whether it's just essential ongoing medication, there's all types of denials. And we were like, well, a lot of these, it's not even the patient. It's like a family member that's already has so much caregiving responsibility is now doing this. So we're like, okay, let's build like a fairly simple AI system to help them. And then that thing has evolved, I'd say in like less than a year, it's evolved from that of like prototype, just like a free thing we built to just like help people that we knew, to then, okay, a bunch of people are using it for themselves, not just like the loved one that they're caring for. Then they're telling their friends and their friends are using it, which we don't even, know. And we're like, fine, whatever. It's, it costs us upfront money to build, but each time anyone uses it, it's like 3 cents. So whatever, just give it away. And then over time, some of these patients were telling the clinics. So then the clinics started using it. And then at that point, I was like, okay, that's like, there's like a market opportunity here. So still just kept it rolling for free. And then we approached, I knew some people at Penn who have funding from NIH. And like we got this grant from Penn and NIH to build it out bigger. So now it's like being used by a bunch of clinics. It's being used by a bunch of patients, patient advocacy organizations. And then we're talking to like small hospitals. So it's kind of like, yeah, the idea just comes out of like, out of problems we're seeing in the market and what we can do. But yeah, we've launched a bunch of stuff.
Yeah, it's
So
really
does the platform, and I'm sorry, what's the name of the platform that connects students
To families.
that are
Yeah, it's called
caregivers to families? What's the name
CareYaya,
of that?
CareYaya, and people can find it at like careYaya.org. Mhm.
CareYaya,
Yes,
YAYA
yes, dot .org,
dot com,
dot .org.
and
Yep.
that's an app too. .org, and
Yeah,
that's
it's
an
an app.
app.
It's basically all a
So
web app, so you don't have to download anything. You can do everything off your browser or just like download a web app. Um, and yeah, it's an app. And of course, on our end, there's a lot more like kind of like manual, but like the way the booking flow works is, let's say if you're a son or daughter of an aging parent, and you're like, okay, my mom lives, I live in Atlanta and my mom lives in LA, and I need to get help, because my mom's having cognitive decline and I want just somebody to be around for 6 hours a day, a few days a week. You go to careYaya.org, you fill in the info. It's less than 2 minutes to fill out the booking. It goes through our system. If you're new and we've never interacted with you, we will do a Zoom call with you, do a background check, and kind of like talk to you about the care needs and make sure it's like companion and lower acuity enough that students can do. And then once you get into the system, then you can just put days and times that you need, and you can get matched with students. And like in LA, we have like a little over 1,000 students at UCLA and USC, that are active at helping people in the community. Best of all, the whole program, we don't charge any fees. So it's the most affordable care in most markets. The whole thing runs off grants and social impact funds. So families book, use the tech.
Oh, so there's no fee. So the company isn't, because I'm thinking the company
Yeah.
takes whatever
Yeah.
1% off of every dollar that the family gives, and then 90 something goes to the caregiver. But no, you're telling
No
me there's
take.
zero
Yeah,
fees.
it's 0. It's basically I was obsessed with affordability. I was like, I'll figure out the financial side later. Not that I'm like, hey, I don't need to make money ever. I had thankfully had some savings from my prior career, but I was like really not focused on like let's make money type thing. It was just like,
Mm.
let me solve a problem at scale, and then figure out a unique way to make it sustainable and monetize. But, kind of the pledge was we will not charge fees for the care.
Does the price change depending on the
Yeah.
market? Are there variabilities?
Yeah.
Like you said, LA is higher. You probably pay your students a little bit more than what you pay somebody in Wichita,
Yes.
Kansas,
The
right?
price changes based on, our kind of
Okay.
like general prevailing kind of like price check is like where the market will clear. But we usually view it as the students are comparing it to what is like a CNA role at a nearby hospital pay, and, ours is like slightly north of that. So in like Raleigh, Durham, if you're like a Duke or UNC undergrad and you're working as a CNA at Duke Hospital, might be making around 15, $16. So, through CareYaya, you can make 17. So we try to like make it price competitive for students that it's like one of their better options to do. And then for families, it's like unbelievably price competitive because it's depending on which market you're in, it's 30 to 50% lower costs.
Now, Neal, if you have Medicare Part A coverage, you have access to home health coverage, which we talked about was not great. And that's my experience to the point that I've pondered whether or not I should just develop my own home health company because we see really bad wound care. Something as simple as a thing called the negative pressure wound assisted closure device. So it's like a sponge and you put it on the wound and it's tied to a machine that sucks and it pulls the fluids and bacterias and yada yada. Well, a lot of times they put the
Okay.
foam too big and they macerate all the skin around the wound, making the wound 2 or 3 times bigger. And so that's just a super dumb example to just show you how these home health care agencies that hire nurses and give them no training or maybe
Yeah.
mediocre training go out there and make things really difficult for me to take care of my
Yes.
own patients. And so that's a long-winded way of saying is have you considered figuring out a way where some of these fees could be charged back to the insurance companies because ultimately it's care. I mean, I know I can't. So
No,
what's your
first
thought
of
on
all,
this?
100%. I mean, I would like to eventually enter those markets, but it might be like a few years. But at the same time, like I don't view this like as a competitively. Like I would love if you just enter that market now because I think the whole thing is so broken. Like I have theories on why it's broken too. And it's like we could charge fees. Like a lot of the families will tell us, yeah, if you charge 10%, kind of like whatever Uber or Airbnb, like if there's just like an upcharge, people would pay it. And I'm just like, there's no point, because for now, we're being measured on our impact and growth, and we are able to get enough funding from our funders purely based on growth that we don't need to charge fees. But I do think there opportunity exists in the market to charge fees. The reason that all of these are broken, whether it's home health for like wound care, or in our case, it's like companion level care for older people with dementia, oftentimes even people on hospice. The reason all these markets are broken is because they're non-tech and they're not scaled. That you have these local companies, and in a franchise or franchisee model, which I believe the home health market is. I haven't studied it that closely. I've studied kind of like the home care market, which is a slightly differentiation. But the way it works is a large national franchisor like Bright Star or Rite at Home Care or Comfort Keepers, whatever the name is, will find a local person in a certain city to say, okay, you buy this franchise for, $100,000 plus 15% royalties every year on your revenues. And then you run it this way. It forces the person into a high price, low pay, to the employee situation. And then the entire way the entire business runs is you have a limited market size. If you do an amazing job on sales marketing, you might have a couple hundred, few hundred clients. You got to make all your money on that. And you got to kind of like saturate the local market with salespeople, buying ads in TV, newspapers, whatever you can. So all this money is squandered and wasted. And that's really why you have a worker who's paid very little, a worker who is minimally trained, a turnover of the worker, which is often approaching 85, 90% annualized, which is insane, right? These workers are just jumping like crazy when they can get a 25, 50 cent an hour raise. So I think it's kind of like a race to the bottom on quality because of the industry structure. So I think if you tried to, do a tech enabled scale play in home health, I think that would be very successful because you could really significantly lower the amounts you're charging families, or in this case, if it's Medicare reimbursable, whatever, just do it at the same rate, then significantly raise the amount you're paying to the care workers and then reinvest, in my opinion, all this inefficiency in local sales, marketing, advertising. You'd have that funds to play with. And then you could significantly improve the quality. You could use that funding towards improving training. You could do a lot with it. So I think that, yeah, there's a real inefficiency in how all of these industries run. And it's due to the waste of sales, advertising money. It's due to administrative inefficiency too, by the way. I mean, you'd be shocked at like the booking and scheduling is all happening over phone calls. Um, Contracting is happening over pen and paper. I mean, it's like such low tech that I think you could really build a tech forward company there, and add a lot of value.
So the question about does Yaya get covered? Is there any
Mm.
coverage for these
Sadly, no. I
students?
mean, it's
They
mostly out of
can't.
pocket. Like, I'd
Okay.
say like 10 or nah, less than 10% of people have long-term care insurance policies where they're able to get some reimbursement for mom or dad, but the vast majority it's out of pocket. I believe that's going to change, by the way. But right now, most of our care, like 90% of that care, 85% of that care is a middle-aged son or daughter taking care of mom and dad with dementia or Alzheimer's. That is not really a covered thing. Um, I think that Medicare is gonna start doing some pilots, like this year, a first pilot launch called the GUIDE program, where, if you're at eligible hospitals or clinics, Medicare is allowing $3,000 a year of care for somebody with dementia, to flow through to support the family caregiver so they can spend that money and get a break, but for the most part, it's all out of pocket, which is like a major financial drain on older adults and, their family members. So it's not a covered service yet. But I believe there's a good possibility it might be covered over the next few years because of the rapidly aging population.
See, how do you see this evolving? Because obviously you
Where
could
are you
see
gonna
this
be in
taking
10 years?
taking this
Like, what
over
happens?
the market, but then how do you still just base it off grants? You know, do you see other people coming into the market with the similar model? Yeah, where do you
Yeah,
see
good
this
question.
going?
Good question. So I think with CareYaya, I think where I see it going is, I think in a home run scenario, I think if everything plays out, as expected, with aging population and significantly growing needs of care, we have now a massive cost leader that's high quality. I think there's an opportunity to build a multi-billion-dollar company. But these online marketplaces become very valuable. They're hard to start and they're a little bit hard to scale. But then once they scale, they have these significant network effects that just lead to kind of like, parabolic growth, which we're now starting to experience. I think at scale, I can get up to 1 million students on this. My math across the country was there's 20 million students, approximately 3.8 million want to go into healthcare professions. And we are achieving 25% market share at the universities that we've launched at and saturated. So, can we achieve close to 1 million students on the platform? I think that type of platform can annually flow through 10 billion plus in care. And then you can make an assumption around take rate of a mature business. Where I see it going from how we monetize is I actually don't think charging just simple markup to the family is needed. And I think there's two things. One, I think that continues a social impact because a lot of people have difficulty affording the care. And it also just continues rapid scaling. Like social workers, nurses, doctors at hospitals love it. We have $0 of advertising and marketing. The whole thing is grown grassroots, which is like awesome. So you have that edge, right? And where I think you can monetize is ancillary services. So like one thing is we want a big grant from NIH for this for caregiver training and upskilling the students to be better caregivers. And of course we provide them basic level training, but they always want more and more. And we're like, okay, we can offer that to you. And we did this grant funded program that we built out called Yaya Guide to empower students who want to train themselves more to get more training. And many are willing to pay for it.
So are we talking about things like
Mm-hmm. Mm-hmm.
CPR and, just kinda give them some basic stuff that
Exactly.
just makes them a little bit
Exactly,
better?
exactly, and they wanna invest in
Mm.
themselves, right? Because 'Cause they're making many of the students who are successfully on the program are making thousands of dollars a month on this. And then really, I think the home run, which you guys have asked about and alluded to, is the reimbursement. Like, not that I'm betting the company on this, but I do think at some point, Medicare is going to start having to pay for home care of our aging population because they already pay for assisted living, they already pay for skilled nursing, but they're underpaying or as in not paying for people to be around. And I am currently doing a research study with Duke, to try to prove out the difference that when you have even just a nice companion, well-intentioned person around, your overall cost to the healthcare system is less because you have less falls, you have less, kind of infections, you pick up things faster.
Absolutely.
And I think if Medicare realizes that with this aging population, let's not just wait until things get bad and then massively overpay. Let's kind of like, pay modest amounts. And we've built this low cost thing that we've scaled. I think that's kind of like the home run where currently it's a chicken or the egg. Medicare's not going to pay
Absolutely.
when you have a buckshot of different care agencies in different cities charging 40, 45, whatever. In LA, by the way, some of these companies are charging $50 an hour. And then when half that money, less than half that money is going to the worker, that's not like, first of all, Medicare's not going to go around the country and do 1,000 deals, right? Or whatever, 10,000 deals and see the inefficiency of I pay this and less than half the money goes to the worker. So I think if you kind of
Mm,
scale something like
mm.
this, you could almost go to the Center for Medicare Innovation and say, hey, look, we built this. What do you think? Let's do a pilot. And I think that's,
Absolutely. They're gonna wanna see
hmm
objective performance goals.
yeah,
That's my experience when dealing with them. They're gonna love things like we improved medication adherence. We improved cognitive because listen, extra gaming is massive.
Yeah.
So like empowering these kids not only with CPR but saying, hey,
yep,
here's 3 games
Yeah.
that are
Frailty
yeah,
scores.
frailty enhancing games, which are sometimes as simple as one of the grants that we worked at Baylor was a uh, an iPad that was on the floor, and the iPad would put a light on the right hand side, and so they'd have to move their leg right,
mm,
and then to the left and left, and doing 10 minutes of this dumb thing where you're just moving your legs
Yeah.
improve
yeah,
significantly their levels of
wow,
sarcopenia, meaning
yeah,
their muscle, it increased their
yeah,
muscle strength, their core strength. So if you add that, you add to your point,
yep,
prevention of falls, mitigation of readmissions for no
yes,
clear reason, because
Yeah.
I can't tell you the amount of patients that you send home and then they're back and you're
yeah,
like, what the hell happened? Nobody came to
yeah,
change my wound
yep,
dressings. And guess what happens? Within 1 week, Pseudomonas
yeah,
all over the leg. It's green,
yeah,
smelly, horrible. Of
yeah,
course they're in the hospital because nobody did basic
yes,
hygiene.
Yeah.
I'm not talking about
yeah,
advanced wound care. I'm talking about soap
yeah,
and
yep,
water, right? So I think you have a golden
yeah,
opportunity that if you, but the question is how to get, here's the deal is because then you start getting into HIPAA, right?
yeah,
Because you need to get clinical
yeah,
information on all these patients. How well are are their vital signs controlled? Are they taking their meds? Did they fall? Did they get readmitted? That's all
yep,
confidential information
yep,
under HIPAA law. So you're going to have to figure out a way to get consent, which I'm sure
yeah,
everybody would get,
yeah,
by the way, to get that feedback so that eventually you can come to Medicare with millions of data points and say, guys, here's the cities
yes,
that I'm in, and here's the impact. Here's the cities where I'm
yes,
not in and here's the numbers. And then that is the striking deal where you're gonna
yes.
strike a deal.
No,
That's what I
100%,
think.
100%. No, thanks for laying off the roadmap because I think you're right, and I think I almost sometimes wonder if it's like easier to offer to hospitals to white label the product and say, hey, you guys use it
Oh,
for your
absolutely.
own thing,
Hospitals
and
are gonna do it.
we'll have the
Yeah.
technology powering
Ye
it.
Hospitals are gonna invest because they get hit by
Yes. Yep.
readmissions.
And I think they can.
They have to pay a
Yeah.
readmission after a big prolonged DRG, which is a bucket of cost that
Yeah.
goes to the hospital. Let's say somebody got
Yeah.
a bypass and they get paid. The patient was in the
Yeah.
hospital for 2 weeks,
Yeah.
bunch of money, right? Hundreds of thousands of dollars. And United Healthcare goes out to the patient goes home, nobody cares for the wound. The patient's back in the hospital within 30 days. That's a 30-day readmission. Boom, you're
Yep.
paying for everything. The hospital now is on the hook and you get dinged because those variables are all very, very controlled by all
Yeah.
these insurance companies. And so that's why case managers are always on your ass asking you, do you need a home health company? Who is the home health company? We need to know 48 hours before the discharge because they're psychotically trying to
Yeah.
control the outcome when the
Yeah.
patient goes home into
Yeah.
the wilderness. So I mean, I think there's also a client there.
Just the medication
Yeah.
adherence, like just the adherence
Huge.
to aspirin and Plavix, it's gonna save
Lives and limbs.
millions and millions of
Lives and limbs.
people's readmissions, complications, just
Yeah.
millions.
Nice. Okay, it sounds like there's a pilot there. I mean, we have what's interesting is like sometimes when your head's down in the thing, we haven't even like really pursued some of these because we're just like right now it's a consumer thing. Like all these families are coming to us and they're booking. So yeah, we have not, pursued a lot of this kind of like let's talk to hospitals, let's do kind of B2B. But no, I mean, I think you guys are right. Like there's a massive opportunity.
This is super,
Yeah.
super, super interesting. And quite frankly, we haven't really even gone down the rabbit hole of denial management. So I'm
So
going to say
I think
this.
you get
We
to
need
come
to come
back.
back.
Sure.
You get to
Yes,
come
we
back.
need to have another
I'm down for
Yeah.
convo.
that. Yeah.
Both offline and online. We'd love to
Yeah.
meet you. You're exactly the type of intellectual appetite that we're looking for.
Cool.
It's so nice when most of the time we spend talking to administrators at the hospital that are C- students. It's nice to have these conversations with just
I
intelligent
think I was going to
individuals
war with every
that are
administrator on
out
planet
there,
Earth. Yeah.
that are out there changing the world for the betterment of the community. Neal, thank you very much for your time, Brad. Man, this has been amazing.
Yeah, your story is inspirational.
Wow.
Thank
No,
you
thank
so
you so much for having me.
So
I
cool.
really appreciate the opportunity. Yeah, thank you. And yeah, would love to
I
chat.
can't
Yeah.
wait. I can't wait to have a second show and then go into
And we
this.
didn't even touch his book, Insured to Death. Like
Insured to Death.
This
God,
guy's like,
we have
yeah,
so much.
we're
This
gonna
is
have you
wrote a
back.
book.
Yeah.
Look at that. Insured
I'll
to Death.
it-
Tell me, give me a snippet. Give me a snippet of what this
Yeah,
book is,
sure.
and then we'll have you just.
The snippet is how health insurance screws over Americans and how we take it back. And basically, the entire thing is around what I see in the field of like the denials crisis and the patients and families it's affecting, the second and third order effects, the financial. I mean, in now running this scale care platform, it's like just absolutely heartbreaking and also absolutely infuriating, of what's going on. And, I mean, I can talk extensively about it, but let's just say in the realm of older adults, Medicare Advantage, and what happens on, people with MA plans when something that happens, it puts tremendous burden on families. And I think that obviously you guys see it, from the impact on, healthcare providers as well. So I thought that was like, okay, you went down a rabbit hole on researching it while I was building these tools because as our care platform grew and as the AI platform grew, I mean, just we're seeing what people are putting in, and it's just like, wow, how is this legal? You know, how is it legal that these insurance companies are able to do this and get away with it? So I thought there was like I kind of wrote the book more, wanted to put the information out there, but really hoping to inspire change. I think that right now, yeah, sure, okay, yeah, we have AI tool out there, great. I'm not gonna promote that extensively. Yes, it can help, but its bigger question is like, why isn't the system being fixed? And I think that why isn't there political action, bipartisan, like I think that heading into 2026, I think patient advocacy groups, provider advocacy groups need to put massive pressure on bringing this up with like, what should we do about health insurance?
The problem is hospital political torque and insurance company political torque is beyond human
Yeah.
recognition. The amount, the PACs and the money behind this is daunting, to say the least. But I think change can be exerted, to your point, empowering knowledge and having people go to the streets and speak up.
Yeah. And we'll have you back to
we'll
talk
have
about
you
the
back
book. Yeah, for sure.
and dive into the book and the AI platform, because I'd really love to learn a little bit more. We're batching again in somewhere in
Nice.
December, so we'll coordinate with your team and make sure that it works for you. But we absolutely want you
Cool.
back soon. Okay,
Sounds good. Thanks so much, guys.
Neal,
All
thank
right,
you
brother.
very much, man.
Thank you so much
Thank
for what
you.
you're doing, Neal.
Nice meeting you
Pura
guys, and
vida.
talk soon.